The Public Service Union of Namibia and the Namibia Retail and Allied Workers Union say the Ministry of Health and Social Services prematurely terminates employment contracts under false pretenses. The workers started working at the Katutura State Hospital in 2017 as cleaners through an outsourcing agreement between the ministry and the private company Adaptic. After that service agreement came to an end, workers were allegedly enticed by the ministry to continue rendering cleaning services at the hospital on voluntary basis with the hope of being employed permanently in the future. They then worked as volunteers for 2 years from 2017 to 2019 without earning a salary. In August 2020, the ministry decided to give them fixed-term contracts, renewable. Recently, the workers received termination notices informing them that their contracts, which were due to expire in December, will be terminated as from Monday. The ministry says their services were only required during the COVID-19 pandemic.
When they started, when I'm talking about 2017, 2018, 2019, when they were volunteering, and before that, they were working at the hospital under a private company rendering services. That was before COVID-19. There was no talk of corona in this country. So this year, the ministry then labeled them deceptively as COVID-19 volunteers. And because of the decline of COVID, now they have a reason to get rid of them. That is deception. They are not COVID-19 volunteers. They were not employed because of COVID. They were employed at the ministry because there was a need to render cleaning services at the Katutura State Hospital before COVID started. And that need to clean the hospital existed during COVID and continue to exist today after COVID.
The unions are urging the ministry to withdraw the termination letters immediately, calling it unlawful and unfair. They are also accusing the ministry of attempting to recruit new cleaners through third parties in the process, overlooking contract workers who have been serving as volunteers.
The ministry shamelessly asked some of these the affected employees here to submit applications verbally for positions, cleaning positions that were advertised no way. They were told, bring your CVs, bring your applications so that we can call you for interviews. Now they are confused. We are told the contract is terminated because there is no money and COVID is no more. At the same time now, you are being asked verbally, bring your application, bring your application. Is that how we do appointments in the public service? Has the Ministry of Health now become a pariah where the public service staff rules do not apply to it anymore? Or what is happening? And if you tell people to go home because you have no work for them, there's no money to pay them, but at the same time you are telling them to submit their application forms and CVs unofficially for them to be employed, what message are you sending to these people? Should they believe you when you say you don't have money?
The executive director, Ben Nangombe, said the unions could have contacted the ministry for more information instead of concluding that the termination is unlawful. Nangombe said the group was employed on a temporary basis as part of the COVID-19 response. He added that the financial resources allocated to the ministry for COVID-19 response purposes are no longer available, and therefore it is no longer sustainable to keep them. But the unions are threatening to lodge an urgent application with the High Court should the ministry fail to withdraw the termination letters. Timo Andreas, NBC News, Windhoek.